NHA CCMA practice test. Question 1. Which lab value is affected when a lavender tube is underfilled? Glucose, coagulation, potassium, hematology test. Lavender top tubes contain EDTA anticoagulant, which preserves blood cells for hematology tests like CBC. Underfilling creates an improper blood-to-additive ratio, leading to incorrect cell counts, altered morphology, or clotting. This can cause specimen rejection and require recollection. Always fill tubes to the indicated mark for accurate results. Question 2. A CCMA finds a hematoma forming during venipuncture. What should they do? Continue drawing. Remove needle and apply pressure. Reinsert the needle. Add a second tourniquet. When a hematoma forms, immediately remove the needle and apply firm pressure to the site to prevent further bleeding and swelling. Do not continue the draw, reinsert the needle, or apply additional tourniquet pressure. Applying pressure for 3 to 5 minutes helps stop bleeding and minimizes bruising. Document the incident and consider an alternative site for recollection if needed. Question 3. Which instruction is correct for a Holter monitor? Remove before showering. Keep a diary of activities. Exercise heavily. Press the electrodes daily. Patients must keep a diary of symptoms and activities during Holter monitoring to correlate events with the ECG recording. The monitor is typically waterproof for showering but not submersion. Patients should maintain normal daily activities, not heavily exercise. Electrodes should not be adjusted by the patient. The diary helps the provider identify arrhythmias triggered by specific activities. Question 4. Which of the following is subjective data? Blood pressure, temperature, patient reports headache, lab results. Subjective data is information reported by the patient that cannot be directly observed or measured, such as headache, nausea, or pain intensity. Objective data includes measurable findings like vital signs, lab results, and physical examination findings. Medical assistants document both types, with subjective information typically recorded in the patient's own words using quotation marks. Question 5. A CCMA must follow CLIA regulations when scheduling patients, performing wave tests, ordering supplies, helping with billing. CLIA, Clinical Laboratory Improvement Amendments, regulations apply to laboratory testing performed on human specimens for health assessment or diagnosis. Medical assistants may perform CLIA wave tests such as urine dipsticks, pregnancy tests, glucose monitoring, and rapid strep tests after proper training. These tests are simple with low risk for error. Other tasks like scheduling, ordering supplies, and billing do not fall under CLIA. Question 6. A patient is in the lithotomy position for rectal exam, pap smear, EKG, hearing test. The lithotomy position, patient on back with hips and knees flexed and thighs apart, is used for gynecological examinations such as pap smears, pelvic exams, and childbirth. This position provides adequate access to the pelvic area. Sims position is for rectal exams, supine for EKG, and sitting upright for hearing tests. Proper positioning ensures patient comfort and procedural success. Question 7. The term hematemesis means vomiting blood, blood in stool, blood in urine, heavy menstrual bleeding. Hematemesis comes from hemat/O, blood, and emesis, vomiting, meaning vomiting blood. It indicates upper gastrointestinal bleeding from conditions such as ulcers, esophageal varices, or gastritis. Blood may appear bright red or coffee ground depending on the location and duration of bleeding. This is a medical emergency requiring immediate provider notification. Question 8. When should the CCMA label tubes? Before drawing. after drawing in front of the patient, after leaving the room, before tying the tourniquet. Specimen tubes must be labeled immediately after collection in the presence of the patient to ensure accurate identification. Labels should include patient's full name, date of birth, date and time of collection, and the collector's initials. Labeling away from the patient risks misidentification and specimen rejection. This two-identifier process is a critical patient safety measure. Question 9. Which pulse site is located on the thumb side of the wrist? Ulnar, femoral, radial, brachial. The radial pulse is located on the thumb side, lateral aspect, of the wrist. It is the most common site for assessing pulse rate in routine vital signs measurement. The ulnar pulse is on the pinky side, the brachial is in the antecubital fossa used for blood pressure, and the femoral is in the groin used for lower extremity circulation assessment. Question 10. A clean catch midstream specimen is used to diagnose diabetes, heart failure, UTI, urinary tract infection, liver disease. A clean catch midstream urine specimen is used to diagnose urinary tract infections, UTIs. The patient cleanses the perineal area, begins voiding into the toilet, then collects the midstream portion in a sterile container. This technique minimizes contamination from skin flora. The specimen is used for urinalysis and urine culture to identify bacteria and determine antibiotic sensitivity. Question 11. HIPAA primarily protects insurance policies, patient health information, hospital staff, lab equipment. HIPAA, Health Insurance Portability and Accountability Act, primarily protects patient health information, PHI, by establishing national standards for privacy, security, and electronic transactions. Covered entities must implement safeguards to prevent unauthorized disclosure of PHI. Patients have rights to access their records, request amendments, and receive an accounting of disclosures. HIPAA violations can result in civil and criminal penalties. Question 12. What is the first step in sterilizing instruments? Autoclave, rinse, soak in disinfectant, pre-cleaning. Pre-cleaning is the first step in sterilizing instruments, involving thorough cleaning to remove blood, tissue, and debris from the instrument surface. Organic matter can protect microorganisms from the sterilization process. After pre-cleaning, instruments are rinsed, then sterilized using an autoclave or other approved method. Failure to pre-clean properly can result in inadequate sterilization and patient infection risk. Question 13. Which of the following is an OSHA requirement? Patient privacy, Sharps injury log, billing compliance, insurance audits. OSHA, Occupational Safety and Health Administration, requires healthcare facilities to maintain a Sharps injury log to record needle stick and other Sharps injuries. This log helps identify hazards and implement preventive measures. Patient privacy is covered by HIPAA, billing compliance by CMS, and insurance audits by payer contracts. The Sharps injury log is a key component of the bloodborne pathogen standard. Question 14. Where does gas exchange occur in the lungs? Bronchi, bronchioles, alveoli, larynx. Gas exchange occurs in the alveoli, tiny air sacs at the ends of the respiratory tree where oxygen is absorbed into the blood and carbon dioxide is removed. The alveoli have thin walls surrounded by capillaries, allowing for efficient diffusion. Bronchi and bronchioles are airways that conduct air to the alveoli but do not participate in gas exchange. The larynx is part of the upper airway involved in phonation. Question 15. Normal respiration rate for an adult is 8 to 10 breaths per minute, 12 to 20 breaths per minute, 20 to 28 breaths per minute, 30 to 40 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute at rest. Rates below 12 indicate bradypnea, which may be caused by opioid overdose or metabolic disorders. Rates above 20 indicate tachypnea, which may result from fever, anxiety, respiratory distress, or pulmonary conditions. Count respirations for 1 full minute, observing chest movement without the patient's awareness. Question 16. Which vein is most commonly used for venipuncture? Cephalic, basilic, median cubital, jugular. The median cubital vein in the antecubital fossa, crease of the elbow, is the preferred site for venipuncture because it is large, well-anchored, and less painful. It also has fewer nearby nerves compared to the cephalic and basilic veins. The cephalic and basilic veins are alternative sites if the median cubital is not accessible. The jugular vein is used for central line placement, not routine venipuncture. Question 17. Which insurance covers active military members? Medicaid, Medicare, TRICARE, workers' compensation. TRICARE is the health insurance program for active duty military members, retirees, and their families. It is administered by the Department of Defense. Medicaid covers low-income individuals, Medicare covers elderly and disabled, and workers' compensation covers work-related injuries. Medical assistants should verify insurance eligibility before providing services to ensure proper billing and reimbursement. Question 18. A CCMA uses the Snellen chart to assess what? Hearing, vision, color blindness, reading speed. The Snellen chart is used to assess visual acuity, specifically distance vision. The patient stands 20 feet from the chart and reads letters of decreasing size. Results are recorded as a fraction, e.g., 20/20ths, with the numerator representing the testing distance and the denominator representing the distance at which a person with normal vision could read the line. An audiogram tests hearing, Ishihara tests color blindness, and specialized charts test reading speed. Question 19. Which position helps a patient with shortness of breath? Supine, prone, Fowler's, lithotomy. Fowler's position, sitting upright at 45 to 90 degrees, helps patients with shortness of breath by promoting lung expansion and reducing pressure on the diaphragm from abdominal organs. High Fowler's, 90 degrees, is often used for severe respiratory distress. Semi-Fowler's, 30 to 45 degrees, is used for patients with milder symptoms or during tube feeding. Supine and prone positions may worsen breathing difficulty. Question 20. A critical value must be fact-checked, documented and reported immediately, sent by mail, ignored. Critical lab values, also called panic values, must be documented and reported to the provider immediately. Examples include critically low potassium, hypokalemia, critically high glucose, hyperglycemia, or positive blood cultures. The medical assistant should document the time, value, provider notified, and any instructions given. Critical values represent life-threatening conditions requiring urgent medical intervention. Question 21. A patient with hypertension will have low blood pressure, high blood pressure, normal heart rate, low temperature. Hypertension, HTN, is defined as consistently elevated blood pressure, typically greater than or equal to 130/80 mmHg according to current guidelines. Hyper- means high or excessive, and tension refers to pressure. Uncontrolled hypertension increases the risk of heart attack, stroke, kidney disease, and other complications. Medical assistants should use proper technique when measuring BP and report elevated readings to the provider. Question 22. What should a CCMA do when disinfecting a blood spill? Use 70% alcohol. Use a 110 bleach solution. Use tap water. Use soap only. The CDC recommends a 1:10 bleach solution, 1 part bleach to 10 parts water, for disinfecting blood spills. This concentration effectively kills bloodborne pathogens including HIV and hepatitis viruses. The solution should be prepared fresh daily. Alcohol is not sufficient for blood spills, and water or soap alone does not provide adequate disinfection. Proper PPE, including gloves, should be worn during cleaning. Question 23. A tympanic thermometer measures temperature in the ear, rectum, mouth, armpit. A tympanic thermometer measures temperature in the ear canal by detecting infrared heat from the tympanic membrane. This site provides a rapid reading that correlates closely with core body temperature. Proper placement is essential for accuracy. The probe should be angled toward the tympanic membrane. Tympanic thermometers are commonly used in pediatric and adult settings due to speed and ease of use. Question 24. A CCMA must invert a tube to mix additives, remove bubbles, reduce hemolysis, speed clotting. Inverting blood collection tubes 5 to 10 times immediately after collection ensures proper mixing of blood with additives such as anticoagulants or clot activators. This prevents clotting in tubes containing EDTA or heparin and ensures even distribution of additives. Gentle inversion, not shaking, prevents hemolysis. Failure to invert properly can lead to clotted specimens, inaccurate test results, and the need for recollection. Question 25. Patient refuses treatment. The CCMA should force treatment, ignore the refusal, document the refusal, call the police. When a patient refuses treatment, the medical assistant must document the refusal in the medical record, including the reason if provided, and notify the provider. Patient autonomy and the right to refuse care are protected by law. Forcing treatment or ignoring the refusal is unethical and illegal. Documentation protects the healthcare provider and facility from liability. The provider may discuss alternatives or attempt to address the patient's concerns.